I think the most popular videos that I have on my channel. And if you're new to my channel, welcome. And check out my jaw videos. If you're watching this one about self-care of the jaw, you might want to see how the jaw can be worked by a professional body worker. And the question I get a lot on those videos is, can I do this to myself? Is there something I can do? My jaw is hurting. I don't live in Portland. I don't come to Portland. What can I do? Well, let's talk about it. Let's just start by looking at this disclaimer. What I'm about to tell you is for information and demonstration purposes and is not meant to be a substitute for actual healthcare. And having said that, let's look at the anatomy. What kind of structures are we dealing with so you can understand what's going on with your jaw? So you're watching this video, your jaw is tight, your jaw clicks, maybe your jaw gets locked up. I'm assuming that it is not actively and acutely swollen and inflamed. And if that were the case, that you would be at urgent care or somewhere like that. But like many of us, you or someone you love and care for may have a lot of tension in their jaw, which is causing a lot of problems. Let's look at the structures underlying this. Over here, very importantly, is this bone. It's an arch of bone. It's called the zygomatic arch. Zygomatic arch. It's a great name. And it's kind of a projection off of this bone, the temporal bone, that's right here. The zygomatic arch is right here. The temporal bone contains the ear and the inner ear and all of the hearing and balance mechanism, which is why when there's issues with the jaw muscles and it pulls that temporal bone into tension and creates torque on the vestibular nerve, it can create dizziness and sensations of fullness in the ear. There's the ear hole right there. This is the zygomatic bone. That's right here. We have the mandible, which is the main jawbone, which is one horseshoe-shaped bone. That's just like this. It's your whole chin. It's your jaw. It has a finger-like projection called a condyle that sticks up and fits into the socket, which is on the temporal bone, and that creates the temporomandibular joint. A couple of the main muscles we're going to be working with. Here is the masseter muscle. It's the one that's highlighted. A little bit of cutaway of the smiley muscle. The masseter muscle actually comes off of that zygomatic arch and inserts onto the jaw. So when it contracts, it causes you to bite. It closes your jaw. It's what we call elevation. It also protrudes, sticks it forward a little bit. That's one of the main muscles we're going to be dealing with today. We also have the temporalis muscle, which all of this area, and the tendon is really cool actually. It goes underneath the zygomatic arch. You can see that arch has been cut away on this diagram, and that tendon inserts here onto the front of the jaw, and when that muscle contracts, it pulls the jaw back, retrudes, and elevates or closes the mouth. We have the pterygoid muscles. There's two main pterygoid muscles on each side, so a total of 4. The external pterygoid or lateral pterygoid, which is the only muscle that opens the jaw. And we have the internal pterygoid or the medial pterygoid, which is a weak jaw closer. We can't reach the internal pterygoid with our hands. There's no technique to directly affect it. But this external pterygoid is a big problem muscle for a lot of people with jaw problems. So we are going to work on it. And we'll come back to it in a second because it's really important. But first, let's look at the back of the neck. So here's the occiput. It's the back of your head right here. And these little muscles on the left side are the deeper. And the muscles here on the right side are the more superficial. And those are important because when your jaw is stuck, the base of your skull gets stuck too. And when both are stuck, your neck you have no chance to feel relaxed and good in your neck. So we're going to work on the whole system. Let's look at the bones under there. Again, here's the mandible. The mandible is the main jawbone. There's your zygomatic process, temporal bone. And these ligaments here, those are the ligaments of the temporomandibular joint. And if we take those ligaments away and we look at the bone, this is what we have. There's that condyle I mentioned before, finger-like projection that sticks up into the socket, which is right here. Mandibular fossa is the technical name for that. Inside the joint, we have a disc and we have some fluid. And if we look at this disc, it is connected to that external pterygoid muscle, that lateral pterygoid muscle. So when that lateral pterygoid muscle is tight and short, it pulls the disc forward, and that creates the deviation. That's why the jaw has to kind of deviate to open to kind of get around that disc. So a big part of what we do when we're treating jaw, when we're helping ourselves with our own jaw, is to work on that lateral pterygoid and get that jaw joint to glide smoothly and get that disc to move smoothly as well. This is a diagram showing how the jaw moves when you open your mouth. When the jaw opens, the mandible basically depresses, but that condyle has to slide forward. So it's like this. If my finger is the condyle, it's like, okay? So those are the movements and the muscles and the structures we're going to be dealing with. Here's that disclaimer again. And while you're reading that disclaimer, I'm just going to talk a little bit about where do jaw problems come from. And really the number one issue is stress. For whatever reason, neurologically, psychologically, we put a lot of our stress into our upper neck, our face, our jaw, our scalp. And that temporalis muscle is very much a scalp and head muscle. And most of the time, and I do mean like 90% of the time, when people who come to me have jaw problems, it's about muscle tension. And sometimes that muscle tension is about they don't have the right shaped teeth and their teeth don't fit together very well. That's called malocclusion, and that creates a lot of tension in the jaw. But really, mostly it's about emotional stress, mental emotional stress. So when we're treating our own jaw and we're trying to help ourselves with jaw tension, we have to acknowledge that the source of this is probably stress. And so let's take our time, work some breathing and some stretching into our self-care routine. So the routine I'm going to show you is going to take you about 10 minutes, and we'll put a timestamp in the video description so that you can come back to this part of the video, because I do recommend you come back, watch it again and again, and do it along with me. We'll also link to the sternal lift video, which is going to help your posture, and the neck stretch video, which is going to help relax your neck. And it'd be nice to do those two in addition to, or maybe before you work on your jaw. That part's up to you. So what you're going to need is quiet space, clean hands, fingernails that are trimmed. If you have long fingernails, wonderful, but that is not conducive to doing this work. I am going to demonstrate with gloves. These are not latex, these are vinyl gloves. They do not need to be sterile, they just need to be clean. Now, if your hands are clean, they're your hands and your mouth, use gloves or not, it doesn't matter to me, but I'm going to demonstrate good practice and using gloves. So here we go. I'm going to take my glasses off, and we're going to start by rubbing our hands together, warming them up a little bit, and let's take a deep breath. Let that breath come into your upper chest and lift your sternum. I'm going to lift your breastbone. You can see my neck muscles contracting to lift that, and then as I relax, I'm just going to let all that go. And the breath in makes our sternum lift, and your chest gets wide, so your clavicles get long, and you lift, and you maybe even want to smile a little bit. Okay, now let's take our hands. We're going to do both sides, but I'm going to show you one. Keep breathing, and you're going to find that zygomatic arch. It's your cheekbone on your face. A couple different ways you can find it. One is just like I am. It's like the outside corner of the eye. Come down and out a little bit, and you'll feel that bone. And see if you can start to gently massage the underside of that bone. Just kind of getting a little bit of pressure points and a little movement on the underside of your zygomatic process. Working all the way back towards your ear hole and all the way front, all the way towards your mouth. And yeah, right about here, where that crease is between your nose and your mouth, that's where that structure ends. So little circles. Moving the skin clockwise, counterclockwise, forward and back. If there's anywhere it's particularly tender, you can spend some extra time there. Okay, now take that and come up to your ear, and we're going to work that temporalis muscle, which is this section here. So on both sides, the sides of the head, enough finger pressure to grab the skin and move the skin on the muscle between the scalp and the bone of the skull. Slow. Keep breathing. If you notice that your shoulders are hunched while you're doing this, you can give your shoulders a break and let them relax. That temporalis muscle comes all the way behind the ear. See, I'm kind of folding my ear so you can see. You got to be on this part too. Right behind the ear, all the way back to the occiput and all the way up. Good. Let's do that again real quick. Get the masseter muscle where it attaches to the zygomatic arch, the temporalis muscle, the sides of the head. You can press as hard as feels good to you. There's really no structures in there that you can injure as long as you are just using your hands. Okay, now we're going to work the other attachment of the masseter muscle, which is right on the jaw. So right here, it's under my beard. Open. I know this is awkward, but I'm doing this with you. Open. And kind of stretching and pulling the skin and the muscle underneath. This feels really good. Good. And if you really kind of pay attention, you can feel where you come off the masseter and just into the cheek where there's no muscle. If you want to really feel the front side, that front edge of your masseter, give a little clench. And you can see mine right here. Masseter. No masseter. See how this is so mushy? So really work along the whole front edge of your masseter. You see how we're like pulling down as we open. Stretch. It's the way you stretch that muscle, just like you stretch your hips. You can stretch your masseter. And now let's push the jaw forward. All right, jutting my chin forward. You may have heard my jaw just click a little bit. And I'm using my hands gently to kind of push forward on my jawbone. And I do mean gently, just to give it a little stretch. Push forward and open. Okay. Now we're going to take our hands on the base of the skull, the back of the neck, the occiput. And we're going to rub from inside to outside with pretty good pressure, all on the back of the skull where all those neck muscles attach. Little ones, big ones, and we're just going to get that nice and warmed up. Okay? Another nice deep breath into your sternum to lift your sternum. Wide through the collarbones. Let those shoulders just kind of sink into a nice, easy position and gently roll your neck now, side to side. Chin kind of aiming behind the collarbone. Gently, just gently. Roll your shoulders. Okay. Now I'm going to teach you what to do inside your mouth to stretch your masseter and stretch that lateral pterygoid, external pterygoid muscle. Okay, so again, I'm wearing a glove. Whether you wear a glove or not, your hands should be clean, your nails should be clean, and your nails need to be trimmed, okay? So what you want to do is take a pointer finger. So my right hand pointer finger, your right hand pointer finger. Pause the video until you're ready. You're going to go inside your mouth. Outside your teeth, inside your cheek. Like this, okay? Open and close your mouth a couple of times until you can feel from the inside that spot right there, the corner of the zygomatic arch and the front of the mandible. It's a really good spot. So we're going to get in there. And what we're going to do is stretch that muscle by pulling out and down. It's like a sweep out and down, gently. Sweep out and down. Sweep out and down. And with each sweep, you want your fingertip to be like a millimeter or two a little farther back. So with each sweep, you're getting your finger a little deeper into that jaw joint, and your mouth is just sort of hanging open in a relaxed way. Out and down. Out and down. Out and down. Okay, now the next stage, we're still working on the same side, is we're going to get our finger way up in the corner, inside, as far as we can, between the teeth and the cheek. And as we open our mouth, we're going to feel pressure as that condyle, that finger-like projection, presses against our actual finger. We're going to let that condyle slide forward and down. We're actually going to kind of sweep any obstruction and muscle knot and stuff out of the way so that your jaw joint has a real nice smooth pathway to open. So get up in there, open, and sweep. So as my jaw opens, my finger again is pulling out, but instead of down, it comes out and forward with my jawbone. And closed to open. Good. One more time. You can do that as many times as you want. It feels really good. It's kind of a good hurt. And when you're ready, we'll move on to the next portion, which is we're going to take our finger on the inside of our mouth, on the underside of that zygomatic arch, and we're just going to sweep gently back and forth to massage the attachment of that masseter muscle. Jaw can be gently open. I like to tell patients, teeth slightly apart. Teeth slightly apart. Here we go. Just gentle but firm. Just massaging the upper attachment of that masseter. And the next step is to massage the lower portion of the masseter. It's really sensitive down there, so take it easy. And right where that masseter inserts on the bone, really tender. Really tender, gentle, gentle. Now, it's 2 fingers, and we're going to stretch our cheek. So the 2 fingers in, and it's just a gentle pull out. Stretch all the muscles in our cheek and all the muscles in that part of our face, like this. Whew, pretty intense. So, taking off that glove, and we're going to do the other side now. Fresh glove, other hand. Give yourself as long of a break as you need. Same idea, okay? So I'm going to do my right side now. My left hand, my pointer finger comes up. I'm aiming for that corner between the teeth and the cheek. And stretch out and down on the masseter muscle. Each sweep is another millimeter farther back toward that corner that we're reaching for right there. Okay. When you feel like you're able to access that corner as close as you can, we're not forcing anything. Do this a little bit every day until you're getting used to it. You're going to open your mouth, and as the condyle of that mandible slides forward, you're going to use your finger to kind of clear the way for it and open space like here. Open my mouth. And moving my finger. If you don't get the hang of this right away, it's okay. Keep trying. Most people, one side is a lot tighter than the other. For me, the left side is much tighter and a lot harder than this side. Now the pointer finger, massaging inside your mouth, the underside of the zygomatic arch. Just like this. Uh-huh. Oh. It's good hurt. Then where the masseter inserts on the jawbone, on the mandible, gently, gently, good. And now 2 fingers inside the cheek, stretch that cheek out. Uh-huh. Whew. Okay, that is how you massage your own jaw. See you in the comments. Let me know if that helps you. And I hope your jaw feels better. Thanks for watching. Dr. Russ signing off.